Patient falls and embraces the impact directly with the palm of the hand. Lunate dislocation causing nerve compression is suspected. Which of the following marked bones is most likely dislocated in the patient? Now, when a patient falls on their outstretched hand, we need to be thinking about three bones. One is going to be the radius over here. The other is going to be the scaphoid bone, which is marked C, or this is going to be the scaphoid bone. And finally, the lunate bone, which is going to be D, can also be impacted. So the radius, the scaphoid bone, and the lunate bone are going to be the bones that are going to be impacted. So the answer to the question is going to be the lunate bone, which is going to be D. Now, what we need to know with outstretched falls is going to be when the lunate bone is displaced with a fall on an outstretched hand, it can compress the median nerve. So it can get displaced and compress the median nerve. If the median nerve is compressed, then patients can present with symptoms of pain on the wrist as well as numbness on the first three half of digits because the median nerve is going to be supplying those areas. So patients can present with wrist pain as well as numbness to the first three and a half digits. Now, if the scaphoid bone is impacted, what you need to know is that because the scaphoid bone is receiving its blood supply from a small dorsal branch of the radial artery, with a fall, this dorsal branch of the radial artery can be teared. And so if a tear occurs, then the scaphoid bone would not be receiving any blood supply. And so as a result, over time, it can lead to a vascular necrosis because it's not receiving any oxygen or any nutrients. So remember, there's two things that are important to know when a patient falls on their outstretched hand. One is that the lunate bone can get dislodged and compress the median nerve. And second, there can be tear to this dorsal branch of the radial artery, and that tear would lead to vascular necrosis of the scaphoid bone because it won't be receiving any nutrients or any oxygen.